As members of Treaty 1 territory, we recognize the land we reside on is the traditional territories of the Anishinaabe, Cree, Oji-Cree, Lakota, Dakota, and Dene peoples, and the homeland of the Métis Nation. We commit to a spirit of reconciliation moving forward together. I now ask all of you to think of the Indigenous nations you share territories and relations with, and the historical commitments you share as relations. May we all commit to a better future together, full of understanding and empathy as community members.
Bienvenue. Welcome to Kelvin High School here in Winnipeg, Manitoba. The Environmental Action Committee is happy to present what our school is doing to fight climate change.
Kelvin High School is involved in lots of recycling activities, such as recycling masks, markers, paper, and more. Bins are in each classroom and the office to encourage everyone to recycle.
Our school has a compost heap to prevent biodegradable waste from going to landfills. With our school's example, we hope to encourage our community to compost as well.
We support active and eco-friendly modes of transportation. Many Kelvin students and staff ride their bikes to school.
These are our steps to fight climate change. What will be yours?
Bonjour, hello everyone. I am Sarah Fontaine-Sinclair, and my interview partner is Lilly Sarah. We are grade 10 and 11 students from Ecole Secondaire Kelvin High School in Winnipeg, Manitoba, and we are a part of our school's environmental action crew here.
We are happy to speak with Louise Aubin, Director of Health Protection Region of Peel Public Health, and Anna Gunz, Physician and Professor at Western University. Ms. Aubin was a member of a working group that created a framework to address climate change that is now part of the Ontario Public Health Standards for local public health units to work with. Dr. Gunz's research interests include improving the understanding of the health impacts of climate change, particularly with children. She is trying to raise awareness to improving health system adaptation to climate change and environmental impact mitigation.
For our first question, please tell us how climate change adaptation is part of your work.
Thank you, Sarah. So for climate change adaptation, my group handles health protection broadly. And so we look at things from food safety to beach water, to vector-borne disease, to health hazards in the community. And as such, my teams have a mandate to do climate change work. We've done a vulnerability assessment that assessed various aspects of our community, looking at things like extreme weather, looking at temperature, looking at vector-borne disease, and have assessed what the impacts could be from climate change, and then starting to move us towards adaptation plans to make our community more resilient to climate change.
So I'm a frontline worker, and I see patients on an almost daily basis, as well as doing my other work. And it's clear to me, with the background in knowledge of climate change and the health effects it has, that we're starting to see more and more patients who are climate victims. In particular, we meet a lot of people who speak about their impacts in the high north from Indigenous communities. So with that awareness, it's really hard to not do anything about it. So we work a lot on mitigation, but adaptation is really associated with trying to get our hospital engaged, working with other frontline workers to work on projects to reduce waste and to really plan and understand how our care delivery will be disrupted and continue to be disrupted with climate change. The healthcare sector is, if it was a country, it would be the 5th biggest emitter of carbon emissions in the world. So it's a huge problem in Canada, and it's a huge problem around the world. So we need more and more people to sort of take this up, to think about it, engage, and to shift their mentality to adaptation.
Ms. Aubin, what are the effects of climate change on community health?
Climate change has impacts both directly. Think of a heat event and people acquiring or getting heat-related illnesses. So that would be a direct impact. Climate change also impacts health indirectly. And in many ways, climate change is a threat magnifier. So if you are underhoused or living in poverty or have language barriers or a whole host of other factors, climate change can actually make those threats to your health even more significant. And so climate change has to be dealt with from a health perspective on those two levels. We need to think about the built form, how we've built our cities, how we live, issues around poverty, as well as the direct impacts.
Wow, that's really concerning in our modern world, how it's intersecting with other struggles. Thank you so much. How much impact does climate change have on the physical and mental health of children?
A huge amount. And what I'll say is exactly how that is we're learning. So heat can affect young people. It can cause kidney injuries, dehydration, as well as we just see a different people coming to hospital more and getting admitted more for respiratory issues and infectious issues. Ms. Aubin mentioned the Lyme disease, tick-borne illnesses around Saskatoon. You have West Nile, and how that's going to change with time. We see people with allergies, so plants and where they live and their pollinating seasons and how long those are also change. Climate change is very linked to air pollution. And in youth in particular, we are worried about their lungs, their breathing, lung development, and the mental health impacts are massive. And that's what we're really seeing more and more in youth. So there's effects that you can get, or the sadness or grief or depression if your community is destroyed or your house is destroyed or someone affected by it. And youth can feel hopeless, despair, angry at the adults for bringing them into this world and not doing anything about it, feeling disenfranchised from the system and political systems. And they can get depression, anxiety. So for all of us, it's about finding our wellness, finding a community, and how do we sustainably pick through this and keep our mental health central to that. We have to remain optimistic because we can change and we can make a difference.
How can students address the effects of climate change on community health?
I think you should just pick something, because at the end of the day, whatever you do is going to improve your community health in terms of accessibility of public transit, as well as making communities walking and bike safe. That will decrease air pollution, which will improve the community. Maybe it's waste. Maybe it's food waste. Maybe do you have a community compost? Do you have a green bin program? Something like that. Maybe there's a real issue with poverty or housing, or maybe there's, there's different social justice causes.
Working with other schools, with your school board, with your local community, with your elected officials. I mean, this is your future. You have a very powerful voice, and making those linkages helps amplify that voice and makes the change. So that would be the only thing that I would expand upon it as to what's been said already.
This is making me really hyped up to go do some work in my school. This is
great.
That's exactly what we wanted.
Well, miigwech, merci, and thank you. It was such a pleasure to talk with both of you. And we hope that these interviews can light a brighter spark within us and the public, showing how much hope adults and youth still have for change. Thank you.
Avec plaisir.